$10,000 in Appalachia will see medical debt forgiven, highlighting national issue. More than 10,000 people in Appalachia will sigh with relief this month after two donors from the region helped nonprofit RIP medical debt purchase and forgive $10 million of medical debt. But it's just a drop. Ontico said the $100,000 donation, which buys the $10 million debt for pennies on the dollar, came from two individuals: Jim Branscombe, a former journalist who became the managing director of Standard & Poor's Financial Services, and author and journalist Bill Bishop. The two men approached. The 10,000 people affected are sprawled across 70 counties in West Virginia, and Kentucky. The nonprofit is need in the region prompted RIP Medical Debt to start a new campaign as it identified $240 million of medical debt across the entire Appalachia region as defined by the Appalachian Regional Commission. Jennifer Bosco, a staff attorney at the National Consumer Law Center and an expert on medical debt, said the rate of medical debt growth was assuaged slightly by the passage of the Affordable Care Act and the 36 states that decided to expand Medicaid, but the repeal of the individual mandate has caused that trend to reverse course. Americans borrowed an estimated $88 billion to cover medical expenses in the 12 months prior to the publication of an April report produced by Gallup and West Health. The same survey, the high cost of medical expenses could be a tipping point for many. More than a quarter of Americans are $400 bill away from having to borrow money or sell their belongings, according to a Federal Reserve study published earlier this year. Approximately 1 in 6 Americans are contacted annually by debt collectors over a health care bill, and 52% of collection items on credit reports are for medical debts, according to the National Consumer Law Center. Almost 60 RIP medical debt has now identified $240 million of medical debt in the counties of Appalachia as defined by the Appalachian Regional Commission, and they hope to target that block specifically in the future. But Bosco said the very fact that the American health care system has reached a point where a nonprofit must cover individuals' debt shows the significant cracks within this structure. It's the same system that has forced people to turn to GoFundMe to pay for their medical bills. The crowdsourced GoFundMe. Crowdsourcing has become so vital to people's ability to afford medical bills that GoFundMe CEO Rob Solomon was named one of the 50 most influential people in healthcare by Time magazine. GoFundMe is not a healthcare company. But without massive changes within the healthcare system in sight, some Americans may be left to turn to the generosity of the internet or pray that their plight is randomly chosen by an organization like RIP Medical Debt, which also uses crowdfunding service Give to raise money.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.